Hi everyone, this will be my last presentation about pharmacology. For previous two PowerPoint, I talk about pharmacology, how to categorize them according to human body systems and drug classes, and then how do you summarize all the side effect and adverse effect of those drugs. This presentation will focus about lab values for those drugs and antidotes and contraindications and meals. Again, feel free to download the templates on the description. And then this presentation is for the purpose of private study and research. I use Kaplan, UWell, registered nurse RN, NCSB, and other resources for these presentations. For therapeutic drugs, you want to remember that. So I call the category then from low number to high number. That way it's easy to remember. So I rank it like that. The reason we need to know that is we want to know that it's therapeutics. I think heparin and warfarin also has a number, and on my previous presentation I did include the numbers. So you can add them to this table. Antidote. The question would like to give you, say, patients on certain medication, and then if they are, let's say, digoxin overdose, then what antidote you should give. And here's the one. So how I remember is DD, WV, HP, MC, AA, ID. So that's how I remember those drugs for it. This one is just pure memory, so once you remember, then it should be pretty good. Withhold medication I added because it to do with certain things. So example, if insulin, then you withhold if BSL is below 70, notify HCP. For example, if you give blood pressure, if blood pressure is below certain 120, let's say 120 to 90, then you need to withhold it. So here is the medication that we need to withhold it. And you just write down the list. Here, this table is about drug contraindication from conditions to the drugs. So if patients are having head injury due to motor vehicle accident, they have increased ICP, then we could not give narcotic analgesic medication because it will mask the signs of intracranial pressures. Again, with respiratory distress, PE, asthma, COPD, we want to avoid following medications such as morphine, benzodiazepines, because it suppresses lung and depress respiratory. So the NCLEX question will give you, say, patient got this condition, and then they are admitted with the doctor prescribed following conditions. Are you going to give it, or are you going to notify clarify with the doctor? An easy example is following what else can I say? Let me see if I can give you an example. Hemorrhage, stroke, no, hair injury. Yeah, here. So if with thrombolytics, the side effect is bleeding. So if patients have following conditions, head trauma, stroke, surgery, BP, hypertension, warfarin, less than 5 days, they are already at risk of bleeding, or they are prone to bleed. So that's why we want to avoid following these medications. This table is about drug to drugs. Let's say let's say this one, so for example, ibuprofen, aspirin, alcohol. We want to avoid with warfarin and cellulosic because of bleeding, because this one does cause bleeding and this medication causes bleeding, so it's double the risk. So that's why we're trying to avoid. And acetaminophen and warfarin, we want to avoid giving to the patient at center, because it interferes with the vitamin K cycle in the liver, which we need vitamin K for warfarin to work. Here, I put about the time frame for giving the medication. This empty stomach, just in general, and then there's empty stomach before the breakfast and after meal. Then there's empty stomach that given within the time frame of before the like medication and feed, and then there's a empty stomach during the bedtime. So sometimes the question can be quite tricky. They say they give an empty stomach, and then sometimes they say, is it before the breakfast, after breakfast, or is it like at night time? And then here with food. So how I summarize it is, I usually summarize the empty stomach, this one, and then assume this one should give it with the food. Things you need to avoid with certain medication. I'll take grapefruit as example because it's quite common in the exam. Here are the following medications that we should avoid giving grapefruit. For this, it's just pure memory. Avoid here. Okay, so this one's about the medication that cause sexual dysfunction, because they'll give you a type of medication, then say what's their side effect, what they're gonna cause, and then if it's this one, then most likely it's one of these side effects. And then interfere with contraception pill. Here are the medication that cause it, and then you also sometimes. They say, oh, patients on contraceptive pill and then giving penicillin medication, what should you do? Like, and then you probably want to encourage patients to get a second, another way of controlling the birth, not just taking a contraceptive pill. Contraindicated in pregnancy are the following medications, so we want to block them. Oh, this one's not showing up. So beta blockers is what does decrease blood pressure, increase heart rates. So it's not good for the pregnancy. So that's what that means. So it's just the beta blocker itself is the function of it. It's not just good for pregnancy. So we want to avoid. Yeah, and the following medications. So sometimes they say which medications are contraindicated with pregnancy, and then they give you 4 or 5 lists. Or they give you like 5, and then do the select or the apply. And that's all. Feel free to leave me a comment under the video, and then you can also shoot me an email as well. And I think this is the end of my presentation. I have made over 13 or 14 videos of NCLEX RN, and I hope this will help you. And feel free to let me know if you're stuck on anything. I'm more than happy to help. Best of luck.